Hello. Let's get some people invited to our little live here. Let's see. So today's live, I'm going to discuss health insurance. So a lot of times people ask me about health insurance and accepting health insurance. And I just want to break all that down for us today. All right, so we're good. We've gotten, I've sent some invites out, so we'll see. Okay, so today I'm going to talk about health insurance, so everyone understands insurance and what it's for and what it's not for, et cetera, et cetera. Okay, so there is this illusion that exists in our culture that if the insurance company, if I have insurance, right, the insurance should cover anything and everything that I need according to my health. So what I want to do is just kind of distinct what insurance is for, right? So if you look at it in terms of like your car insurance, for instance, or your house insurance or your life insurance, etc., it's there for a catastrophic event. Okay, so that's the original premise to why health insurance was created. It was created so that, you know, I'm maintaining my health and then, oh my gosh, God forbid, I get into a car accident or have a chronic disease or something like that, that I can leverage that insurance so that I'm not going into debt or losing, you know, my, you know, livelihood, et cetera, and I'm able to manage the debt. So that's what health insurance is really set up for. The challenge is that in our culture, we've used our health insurance as the go-to for our health care. Meaning that if I have a cough or cold or whatever, and I'm reactionary, I'm clueless, I don't know how to take care of myself or heal myself, and then I become afraid, and then out of that fear, I go into the ER, and now I go get treated at XYZ. So the ER, the emergency room, is there for an in fact emergency, not as a result because you're afraid and you don't know what to do, and then you go to the ER as a result. That's a very expensive means of healthcare, right? But a lot of times with people that are uninsured or underinsured, they go to the ER for their healthcare because they don't have insurance. So they'll be turned away if they go to some of these other clinics, etc. So I want you to understand that component, right? So let's look at chronic disease, right? So chronic disease happens as a result of someone not taking care of themselves, not healing, not doing what they need to do, i.e. drinking enough water, eating healthy, moving their body more, keeping their thoughts healthy, body, mind, spirit, etc., right? Not taking personal responsibility with my health, then it becomes a breakdown of health, and then now I want to go manage that health using a pharmaceutical, a surgery, a procedure, etc., right? That's what allopathic medicine does. It manages disease process. It's not curative. That's not the role of it. It's to suppress the symptom long enough for the patient outcomes to improve, right? But it's an illusion of improvement because a lot of pharmaceuticals have synthetic side effects. But we use pharmaceuticals as a stabilizer, right? So you take a pharmaceutical to stabilize the symptom while you're spending time working on figuring out the cause, because it takes time in order to determine what the cause is, right? So complex healthcare issues, they take time to figure out, right? They're not an instantaneous fix. We look at this clue, we look at that clue, we look at this clue, and if we're following proper therapeutic order, we're also going to go for the less invasive, least expensive treatment, lab testing first, and then go to deeper lab testing, deeper treatments, etc., that are more expensive. That's the naturopathic approach. So a lot of times people don't understand coming into my practice why I choose not to accept health insurance. Okay, so I did accept health insurance for some time before healthcare reform happened, right? And so what I found as a provider, I was consistently spending more time chasing after being paid than I was actually treating my patients. A lot of times people have this thought process that we as healthcare professionals, we're supposed to be indentured servants, meaning I'm supposed to work for free or less than nothing because, it's a service, or I'm supposed to feel bad or feel guilty or feel sad that you as the person have not taken care of your health or not. And I know that sounds cold, right? However, I wouldn't run my car down to nothing, like never change the oil, never change the tires, don't do anything with my car at all, and then go to the mechanic and say, I need you to fix this car for free, right? Or I want to fix this car for less than nothing. An insurance company actually cuts our bills down like crazy. That's why when you go into an insurance-based practice, the wait times are out of control. And a lot of times the providers overbook themselves because it's literally a numbers game. Because one person's insurance may pay me $2, another person's insurance may pay me $200, right? And so now I'm working off the law of averages. And so for me, that game, that's what I call it, that game was so stressful, so expensive, so just not healthy for me as a provider when all I wanted to do was treat people and help them get well. So then I come into this conundrum of, having 6 degrees, there are a lot of implications to that. So for one, I incurred over $200,000 worth of student loan debt to be able to have the education in order to treat you. So that I have a giant tool bag so that when a person comes in, because every patient's different, every case is different. You can have 2 diabetes cases and have 2 totally different treatment plans because everybody's genetics is different, everybody's health implications are different, the environment that the cells are put in are different, everybody's different. So I treat them bio-individually, meaning I treat you as an individual, not just because you have this XYZ condition that automatically assumes that I'm going to treat every single person with your condition the same. It's very individualized, right? So I have a big tool bag for that. So I incurred that debt, incurred that time to be able to educate myself enough to be able to listen and discern and go, okay, so Mrs. Jones, you have this going on, so let me help you with this. This part of the tool bag is going to help this part of the tool bag. If you didn't catch my video on functional medicine, et cetera, please reach out. Please check it out on our Facebook page because I talked about all the various degrees that I have and why I have them and what I do with them, et cetera. So I discern that a little bit. This talk is more so just about the insurance game, so you understand that piece of it. So just as a naturopath, the average initial visit with a naturopath, national average, is between $250 and $400. That's just one visit, the initial visit. Then follow-up visits are $100 to $200 a piece. Okay, so you do the math, right? And again, I told you complex chronic disease takes time, right, in order to heal. And that's just for the visit. And that's 1 degree. So I have a naturopathic degree, 1 degree, $250, $400 initial visit, $100 to $200 follow-up visit. That does not include supplementation. That does not include lab work. That's all additional, right? So a chronic disease takes time. It takes time to peel back these layers, understand causative, understand how this person got to this perspective. And because I follow therapeutic order, least invasive, least expensive first, and then kind of go from there, right? So when I was looking at building my practice, I said, okay, even me as a doctor, I couldn't afford to see a naturopath, for 3-4 visits. And then especially too, because a lot of times when you go see those providers, what happens is people go, oh my gosh, okay, so reactive medicine. So here's the lab work, here's $400 worth of supplements. Now you're taking, $400 something, $500 worth of supplements on top of your office visit. So now $250 to $400 for the initial visit, plus the cost of labs, plus the cost of supplements. Now you're walking out the door with, $1,000 to $1,200, $1,500 off of one visit, and it's not going to be effective because you need long-term care. You need education, you need coaching, you need support, you need somebody to hold your hand, tell you it's going to be okay, tell you that you're going to make it. I'm a constant cheerleader and advocate, because I know there's mind games that happen when you're not feeling well and you want to get well. So I give all my practice members my cell phone number so they can reach out to me, right? And so I can guide them through, because also too, I know how to heal my body, but unfortunately, most people aren't taught. They don't know how to heal their bodies, and everybody's different. So now I need to put my pulse on them, so that we need a two-way communication. I need for them to tell me in real time what's going on, because that's information that it's going to give to me that I can say, okay, now do this. All right, nope, that didn't work. Now let's do this. Okay, let's get this. It's a process of elimination in a therapeutic order, right? So one of my certifications is in functional medicine, right? So functional medicine, average cost of care is around $4,000. So initial visit, and I'm looking at my notes here, initial visit's about $460 national average. On the low end, $125. On the high end, $1,250. One visit. That's one visit, okay? Again, lab work's not included, supplementation's not included. You're now looking at some pretty hefty cost, right, for care. And again, as a provider, we've put the years in, we put the training in, we've incurred the debt, we've taken on the responsibility to be able to teach you, right? And so I'm not saying it's not worth it, right? It is worth it. However, the understanding is this, right? So you go into a provider, you pretty much are dropping 40, 50, 60 years, right? Worth of 30 years, right? Worth of disease, unhealth, that some of which you've brought in genetically, right? And we're not even talking the psychosocial, spiritual stuff, right? We're just talking about like years of unhealthy eating, years of bad habits, years of ignoring your health, years of fight or flight reactive, not doing what you need to do for whatever reason. There's no judgment. We all are there, right? We're all doing it. I'm very fortunate to have been very present. I was very sensitive early on, so I was very present to my health, because if I ate something, I'd get sick, right? Now I understand why, because I healed, right? So, there's all of these different components, right? So people criticize me and my practice because they come into the practice. The initial visit with me, you have two options. You can do a 15-minute complimentary wellness visit, totally free. You can come in, we'll talk, we'll chat. You walk out the door, I give you value, you don't pay me a dime, right? Just to educate you, right? If you do a consultation, that's $200, right? So that covers your first 2 office visits. Right? So then a person, because again, I'm not going to fight with your insurance company. I'll give you a super bill, which means I'll give you an invoice that you can give to the insurance company, and they're more likely to reimburse you than they are me, believe it or not. Again, the insurance companies see us as indentured servants, the patients see us as indentured servants, and the providers are the ones taking the burden, right? So that's why I eliminated that. I don't want the stress. My health is important to me. I don't want to be, and to run a medical practice, just FYI, costs between 40 and 45 grand a month to actually run a fully functioning medical practice with staffing, et cetera, et cetera. It takes a lot of time, a lot of energy. You're talking 80 hours a week of work at least, right, to get it going off the ground, right? Which is worth it to me to help people heal, right? So the patient comes in, it's $200 for the first initial. That second visit with me, which is included in the $200, which let's say you do a 15-minute, you can just pay for the separate visit, the $100 for the review fee. If you do the consultation option, you get more time. That's the cost ratio. So in that review, I'm giving you a 20 to 30 page report that goes over your lab work in depth, more than anyone else has gone over your lab work, guaranteed. The reason being is because of those additional years of training. Second doctorate degree, last 2 years was in laboratory diagnostics, biochemistry, another 2-year postdoc training in biochemistry, 4 years of biochemistry training and laboratory diagnostic training. The amount of knowledge and insight and wisdom that's gained. So I don't have to run every lab test underneath the sun. you'll listen to a lot of podcasts and different, books and things like that from national providers that are like, and they give you hope because you're not getting what you need from the regular medical community. So it gives you hope and says, oh, now let me go run thousands of dollars worth of lab tests. You don't have to run all that stuff if you know what you're doing. Remember wise, it's just a moot point, right? So that's why we do it. So a person comes in and then I give them the option that they can choose to move forward. Now, I recognize that, 6 degrees and all that training, 18 years. So my per office visit fee is $325. I haven't raised that in years. $325 per visit for a 30 to 45 minute appointment. I realize that people cannot afford that long term. And I also realize that financial health and well-being is just as much a part of their health as anything else. And so I don't want to put people in credit card debt or put them under great amounts of financial stress in order to treat them. So I say, okay, you know what? Let me assess the case. So I assess cases. I have 5 basic plans. I give about a 40 to 55% discount, and then I bill a plan accordingly. So I have an annual plan, a quarterly care, a preventative care, a chronic care, and a acute care, right? So depending, and it's rated based off of the amount of work it's going to require on my end and the health of the person. And how much I need to teach them. My job as a naturopath is to teach people how to be well. And also with a master's in public health, it's to teach people how to be healthy. So what I do is I use this as an educational tool. So over the course of a year, I'm teaching them so let's start with preventative care. Preventative care with me is $2,100 for the year, right? So you go from, instead of paying $325 per visit, right? And that doesn't even include detox appointments. It doesn't include sick visits. It doesn't include $325 per visit. You multiply that by 12, right? You're around $7,800, that sort of thing. You're paying $2,100 for the year. So I discount my fees and pretty much incentivize you for long-term care. And the reason that I do it that way is so that you can actually afford to be treated and afford to get the care that you need, right? If you went to a naturopath, a functional doctor, a mind-body specialist, mind-body medicine specialist, a holistic doctor, pretty much if you went to a doctor, if you went to all the providers that I have education in, meaning because I'm very specialized, but I have this big tool bag that I pull from, right? So if you went to a functional medicine doctor, that's one fee. If you went to a naturopathic doctor, that's one fee. You went to a mind-body specialist, that's another fee. If you went to a nutritionist, that's another fee. If you went to, if you went to detox clinic, that's another fee. All of these different areas of education and training that I have all have separate fees, but you get it for one fee. You get me for one fee. And all of that understanding and 18 years worth of knowledge and wisdom that I've gained in the natural healthcare field, right? So I discount it by 40, 55, 60%, $2,100. So if I am doing that, and if I'm going out on a limb for you, because I could not care, and I could say, you know what? I'm going to charge $325 per office visit. You're going to pay that. That's it. Sorry about your luck. But I actually care about human beings. And I care that people are sick out there and that could be well and could have their lives back, right? And so I discount it to make it affordable, right? And then I said, okay, well, you could either pay it in full, you can pay it in 60 days, no interest, or then you can pay it on a monthly basis, right? But then I have to pay somebody to manage the accounts in order to pay for that, right? So then we have that component, right? They have the billing component, et cetera, right? So again, I'm trying to help you understand, right, that in order for me to do that, I take great risk. Okay. And so taking that risk, I have people sign agreements with me. That it's like any other business, right? I'm not an indentured servant. I'm not going to work for free. I'm not going to treat you for free. I know that I care, and I love that I care about people, but I also care about myself too. And I care that I'm being honored for the work that I'm providing, as all providers should be. As a healthcare provider, we work really hard. we take the brunt of a lot of people's emotional reactions, their stress, their fears. We're there on the front lines in healthcare. And so, having people sign agreements for that, and us having that agreement secures that I have the revenue in order to keep my practice open, secures the person, right? So yes, I have to organize things, right? I order labs for patients twice a month, right? Or not twice a month, not labs, supplements. I order nutraceuticals because I'm ordering mass for, hundreds of thousands of people, right? So I can't order every single day, which means there's lag time. So there's a lot of structure in the business of healthcare. And I think people forget that healthcare is still a business. It's not this emotional, I'm going to give my soul for nothing. We still have to maintain, unless Dominion Power is going to provide me lights for free, the water company will provide me. If everyone donates to the practice, it will be a free service from now on. And then I can wait around and hope that the insurance company pays me. So I hope this was informative. The other thing too with health insurance to be understanding is that if health insurance has a certain order, meaning that if you go into it and they say, okay, so I know Mrs. Jones, you're having a low back issue, but we can't give you an MRI first. We have to send you to physical therapy, and you have to go to physical therapy for XYZ appointments, and then you can come back and then we can give you an MRI. So you have to exhaust that. So you don't have healthcare freedom with insurance-based models. With private pay, with pay for service, you have freedom with insurance, with care. You can choose what you do and what you don't do. So that's the other difference. The other thing is the cost. Like, this is an example that I pulled. So Humira, which is a medication to treat autoimmune diseases and rheumatoid arthritis, things like that, $38,000 a year for that particular drug, which is an 86% increase from 2012. Okay. Surgery, co-pays, drug treatment, side effects, quality of life, spinning in circles, not getting the results. We know what that means, doing the same thing, expecting different results. That's what you get with insurance. Okay. The providers get, have to see more and more patients, have to provide less and less patient care. We're exhausted, worn out. Our brains shut down. We can't think clearly. We can't make healthcare quality healthcare decisions because it's a numbers game. We have to run a certain number of people through and hope, that the law of averages works and that we get enough billing. That's why I don't accept insurance, because it doesn't work. As a provider, it doesn't work for my health. And if I'm trying to be the leader of what health should look like, if I'm worn down, stressed out, not being able to just function and live my life, plus pay my student loan debt, it won't work. So we went concierge back in 2012 at the beginning of healthcare reform. And so we do have agreements. We do require 60 days to terminate it. You can early terminate at any time, but you lose your discount and you have to pay, because I'm taking a risk financially to discount my fees in order to help stand for you and your health. Because I know that if long-term care works, and if you follow the process, that's a slow, deliberate, consistent process that's done over a long period of time, and I take my giant tool bag and I teach you from that tool bag, at the end of the year, either you don't need me anymore because you've learned what you need to learn, or you step down and you need me less and less, and that's the goal. You need me less and less because now you're armed with the education and the tools and the wisdom to know what your body needs, not anybody else's body, but your body needs in order to heal itself. Right? And that's why I've become a concierge practice. That's why we're a membership-based model. I'm proud that we're a membership-based model. We have definitely survived the healthcare reform because, as you knew, a lot of practices either went under providers retired out because they just didn't want to deal with it, and it's just gotten so contentious back and forth. So thank you so much for tuning in. Hopefully that helps you understand more about insurance, etc. The last thing I want to leave you with is the cost of chronic disease management in this country for preventable conditions, metabolic health conditions such as hypertension, diabetes, high cholesterol, etc., is going up and up and up and up and up. And unfortunately, the allopathic doctors are not equipped and trained to handle these effectively, and nor do they have the time, because that's not their role. Their role is to stabilize you, send you on your way. Stabilize you, send you on your way. They don't have this infrastructure to teach you, hold your hand, support you, encourage you, guide you through. We just invested in a metabolic health machine that assesses all your metabolic health measurements, your visceral fat, your BMI, etc. It's tapped into an app that we have that you can track your food. We can push content to it. We can keep you accountable. We have built the infrastructure over the last 10 years that this practice has been, or at least me, I've been around this area. This practice has been open since 15. But the last 10 years, I've been building this infrastructure in place to help you to not only manage your chronic disease, but reverse it and prevent chronic disease from even happening. True prevention, not just prevention as a word. So thank you so much for tuning in. My name is Dr. Erica Steele with Holistic Family Practice, and we proudly help families live naturally.